once the blood is donated, it has a lifespan, 35 days. So if it was donated today and then screening is done 1 week after, it will have reduced the turnaround time of it to be transfused to the patient.
I want to thank you so much for your tremendous support that you gave me on my previous episode. Allow me to introduce today's episode. I'm your host, Pauline Gure, and we have with us a very important guest with us, and I want to give her an opportunity to introduce herself and to tell us more on what she does.
My name is Felista Njoki Mogo. I'm a lab unit manager in a mission hospital within Thika, and today I'm delighted to be with Pauline here to discuss a very important matter about blood.
Thank you so much, Felistas, for being with us. The reason why I wanted to invite you for this show is because you are very passionate when it comes to issues to do with blood donation. And I can tell you we have seen what you have done, and I want to appreciate so much. Maybe nobody has told you that. Kindly tell us, why is it that you are so passionate about issues to do with blood?
There was once time my sister was involved in a road accident, and she lost a lot of blood, and she needed blood for replacement of what was lost. It was during that COVID time, and you know, during COVID, everything was closed up. So there was a shortage of blood, and we had to intervene a lot for us to get the blood. My sister succumbed.
Sorry.
But I decided from that moment I'm going to dedicate my time in harvesting this precious commodity for the patient who may need it. So anytime you find me involved in blood donation, just know that this is the reason as to why.
So you are the one who is involved in the collection of blood, and you follow it up as a lab technician through the whole process up to the point where it goes to the patient. Would you kindly take us to the behind the scene of the blood donation up to the point where it gets to the patient?
What we do is, the first thing that comes in place before blood donation, the person donating blood must be eligible. And for the eligibility, that person must be over 18 years, between 18 years to 60 years. That person must be healthy, not having hypertension or diabetes. The other criteria is that person must be, there is a questionnaire that you fill when you go to do the blood drive, whereby it captures the question that you're going to be asked, and they capture the weight, the temperature. And another important thing is that you should have eaten something before you donate that blood. Once you go there and fill the questionnaires and you are found to be eligible, what they check at that point is the HB. HB is the hemoglobin levels, to know the blood levels that you have. Once you qualify, because the HB should be between 12 to 18. Once you qualify with the HB, you can now proceed to the donation of the blood. The donation itself takes roughly 15 minutes. And once the blood has been donated, it is stored at the ideal temperature for awaiting for patient to be transfused.
You have told us about the prerequisites for the blood donation.
Yeah.
And this blood will automatically go through the various steps of testing.
Yes.
Would you kindly take us through that?
One thing that I need to make it clear to the people and to the viewers out there, those people who are afraid of donating blood, thinking that maybe you'll be screened at that point and be told that you are having some diseases, don't take that fear, because what happened, once you donate the blood is taken to a screening area which is in Nairobi for this region of Thika. In there it is screened for 4 diseases. We have HIV, hepatitis B, syphilis and hepatitis C. And these things are coded. Like we have A coding for HIV, B coding for, so once it goes through the screening, if in any case the blood is not okay, it will say it has been rejected courtesy of D, for example, D, which might be syphilis. And these things are coded in that nobody will even know whose patient or whose sample that was. So you can rest assured that your secret remains in the hospital or in the place where you have donated.
What happens in case blood is rejected?
Yeah.
What happens? Do you follow up on those people, are you able to follow up and know whose blood has been rejected and take maybe a necessary action? Maybe you can reach out to them.
What usually happens is when you come for blood donation, you are given a barcode reader, which you stay with it, and one stays in the facility where you are donating the blood. Using that barcode reader, you can be able to come back after 2 weeks to know how the blood, your blood was okay or not. In that, they will have sent the results into the facility, and in case there was anything that was not okay, it will be coded. It was rejected courtesy of this, or it was okay. And you are the only person who can be able to get that information. Nobody else can get your information.
So not even the healthcare workers that are able to tell whether a certain person's blood was rejected?
No, it's only you alone
who can just do the follow-up and find out whether your blood was eligible or your blood was rejected.
Yes.
While trying to maintain a steady supply of the blood, what are some of the challenges that you meet?
There are a few challenges that you meet as we try to maintain the stock of blood. And one of the challenges that we face is at times the donors who have donated this blood, once it is rejected, and for example you are donating it for a patient, and that patient needed like 5 units, and it is 5 people who have donated. In the event it goes the process of screening and one does not qualify, the challenge that we have is the patient will come in and tell you that we donated 5 units, but you have only been able to get 2 units. Because the issue of blood will be issued based on the amount of blood which has passed screening. The other challenge that we face is that people have been fearing to donate blood, and that is something that we want to rule out today, thinking that the results will be told to other people, but that is not what happened. So feel free to come and donate. Another thing is, in terms of emergencies, you might not be able to predict how much of blood you may use. You may have ordered or requested for a certain amount of blood, but emergencies comes in and you need to take care of those emergencies. So that is a challenge also, because this one will result to the patient staying in the hospital for a longer time, simply because emergencies came in, and those are things that you cannot predict and know when they will hit.
Okay. We have various types of blood components.
Yes.
People needing various different types of the components. Others need a whole blood, others will need just red blood cells, others will need plasma. How do you go about the process of the processing the different components?
What happens is, once the blood is donated from the vein of the donor, that blood is processed, and one thing, it will depend on what component need to be harvested. So we have the blood product, and the blood products here are packed cells, packed red cells, we have frozen plasma, we have platelets, and we have cryoprecipitates. Each and every of these blood product is used to treat individual cases. If, for example, you find a patient need packed cells, I would rather the patient be transfused with the packed cells rather than the whole blood, because that patient might not be needing the plasma. And in the scenarios where we need to transfuse the packed cells is like when there is bleeding and you need to replace the HP that was lost. You can also transfuse the patient with plasma, frozen plasma. This is very good, especially for the mothers. Where we have postpartum hemorrhage, plasma is very good because it is very rich in platelets, and they will be able to arrest the bleeding that the patient is going through. Then we can also transfuse the platelet in a scenario whereby a person does not have the clotting factor. Platelets are used to help in clotting, and in layman's language is clotting. When you are bleeding, there is something that forms for it to arrest the bleeding. That platelet are the ones which are used. So they are very good to be transfused to people who have tendencies of excessive bleeding. Same case applies to the cryoprecipitate, because it is very rich in fibrinogen, which is also help in anti-clotting.
For the cryoprecipitate, just how much do you need?
Cryoprecipitate is hard even to get, because for you to get the cryoprecipitate, it is the the precipitate that remains after you have taken the plasma. Remember, I told you in the beginning that the blood has 4 parts. We have the liquid part of the blood, which is the plasma, and it is one that contains white blood cells, red blood cells, and platelet. So the plasma, once you transfuse the plasma and there is the precipitate that remains, that is what forms the cryoprecipitate, and you need to combine with more and more for it to be transfused. So cryoprecipitate is a bit rare, but it is very good and rich in fibrinogen.
How fast can we get platelets?
Platelet, for them even to be manufactured, it requires a process, because once you separate this whole blood, when you get the plasma is when you can be able to centrifuge it again under high revolution so that you can get the platelet. And the bad thing about it is that platelets are only valid for 5 days, and they require to be agitated. They require to be stored at room temperature with constant agitation.
For the platelets, once you get them from the blood bank,
Yes.
how soon should the transfusion happen?
Actually, when you go and get the platelet from the blood bank, it should be constantly agitated. So the transfusion should be the soonest, because they lose their potency if they are not constantly shaken.
Okay.
Actually, in the process of even transfusing, you need to keep on agitating.
Okay.
You say dancing with the sample, so that it will not stick on the walls of the blood bank.
From the point where you get the blood from the blood bank,
Yes,
it was already in the fridge.
yes.
At what temperature was it?
2 to 8 degrees if it is whole blood or packed cells.
Okay.
If it was platelet, at 5 at room temperature. Yes.
Let's talk about the red blood cells and the
Yeah.
whole blood.
Yes.
Once you get it from the blood bank and then you take it to the patient,
Yes.
or how soon should you transfuse
Okay.
into the patient?
From the moment that you get blood from the blood center, you are supposed to maintain cold chain. And cold chain here, I mean the blood should be stored between 2 to 8 degrees, minus 2 to 8 degrees. So this process has to be maintained from the moment you pick it from the transfusion facility or from the donation site. You're supposed to carry it in a cooler box with ice pack. And once it reaches in the lab, there is a procedure that is usually done called cross-match. Cross-match is to check the compatibility of the blood of the donor and the recipient. Once you have done the cross-match and found that it is okay, that blood is supposed now to go to the patient, but the cold chain must be maintained. So even the person picking that blood should come with a cooler box so that we can maintain the cold chain of 2 to 8 degrees until it reached the vein of the patient. Initially, we had people who are warming blood, but now you don't need to warm it anymore. Once you get it, it should go direct to the vein of the patient. And one thing that is need to add there is that that blood bag has a number which can be traced all the way from the donation site to the patient. That number is the one that they follow it up. They can know from the region blood transfusion center, we issued this facility with this blood, and they can follow it up to know whether that pint was transfused to the patient. Because every other blood group, every other blood bag has a pint number which is different from the other.
Once you get it, you get the blood out of the fridge that
Yes.
you're going to take to the patient. Of course, you're going to use a cooler box to the bedside,
Yes.
so you don't give it any time maybe to cool. I think there is the perception that if you give it directly, it's going to cause some reaction. Is that a thing?
Okay, that is something that you need to clarify. Initially, that's what was happening. They were saying it need to be given time. But from the take is, you are supposed to maintain that cold chain until it goes to the patient. Because the moment you now warm it, it will go outside this range of 8 degrees. And remember, for it to be able to help the patient, it must be within that temperature. Because when the temperatures are altered, a lot of the blood product inside it will deteriorate.
In case of a blood reaction,
Yes.
you know, nurses are very good at noticing a blood reaction.
Yes.
And they're going to take necessary steps, including stopping the blood immediately
Yes.
and returning it back to the blood bank. We do that very well.
Yeah.
Once we bring that blood to you, what do you do with it?
We have major and minor blood reaction. A major blood transfusion reaction is a reaction whereby there was a mismatch of blood group. For example, the patient was A positive and maybe was given a B positive. A reaction will be very major, and that one, when it comes back to the lab, we do the regrouping again of the blood to confirm whether it was the same blood group that the patient was given. For the minor reaction is how the body reacts. We have our bodies and they react differently. You might be injected, you produce a pimple or something, but somebody else doesn't produce. So for the minor is for how that patient reacted. But what we do and what is normally done, we document it, that there was a blood transfusion reaction. And once we document, we regroup again. And we ask for further tests to the patient. We may ask for the urine, because we want to know if there were bilirubin. We may also ask for liver function test.
So do we have specific blood groups
Yeah.
that are usually on short supply?
Okay. Blood group, it's important to mention even the types of blood groups that we have.
Sure.
We have 8 blood groups. And in these 8, I will go to, we have O negative, we have O positive, we have A positive, A negative, B positive, B negative, AB positive, and AB negative. So in those categories, there is this theory, or even it is known worldwide, that rhesus negative is 1.5% are the people who are rhesus negative. So in all these blood group, the most and the rarest blood group is rhesus negative.
What is the ideal frequency for which a healthy person should donate blood?
Donating blood is very healthy. That is where we should come in. The more you donate, the more is produced in the body. After every 4 months, you can donate, if it's for the gentlemen. But for ladies, because you know what happened, there is menses and those things, blood loss, 2 times per year. But in case you are healthy and you are okay, 4 times will do good in a year.
Do you have a specific population that is your preference for blood donation?
Blood donation is a regular activity, but for us to get massive blood, we normally call for the campaigns, especially in schools, and we have institutions. That is where we are able to harvest the biggest numbers of blood. Because when you rely on the patient or on the donors who are going to come to the institution, there will be not many. We also even go to the police barracks, whereby the armed forces and the disciplined forces also donate the blood.
Okay.
Yes.
That is very interesting.
Thank you.
Do you have recommendations to address the blood shortage?
Okay. There are a lot of recommendations that we would give to address this issue, most especially to our clinicians in the ward. It is always good to transfuse what the patient needs, because we have had cases whereby patient is being transfused with the whole blood and that patient did not need the whole blood. Let's transfuse what the patient needs. If they need packed cells, let's give them packed cells. Let them give plasma or whatever that is needed. Again, let's have other alternatives of transfusion. Let transfusion be the last option. Let us look into other things, because we have hematinics, which can also be used to resolve the issues of HP. We also have plasma expanders. There's a way you can, if the patient has lost a lot of plasma, you can give the saline as a way of replacing. Also, we have iron sucrose, which can also be given to the patient, because at the moment we are experiencing a delay in the testing of the blood, because there is no reagent for screening of the blood. So you find that a patient stays in the hospital for long. This patient could have been admitted for transfusion of 5 units and you're only able to get 2 units, you are not able to get these other 3 units. Can maybe the doctor look for other alternative to be able to take care of this? Because if that patient will stay for the hospital for long, it will increase the stay in the hospital. And you know, there are other infections that you can get in the hospital set up, and this will in turn increase the amount of bill that patient will pay. You know, we have problem with cha and she, so there will be that problem. So if there is a way we can have other alternative and transfuse only when it is necessary. And I think it is good to also get a cut-off point, because at times you find the patient has a good HP, but the doctor is still insisting we do transfusion. I think we should identify a cut-off. If we say it is less than 5, let it be less than 5.
I think the ideal one is less than 7.
The ideal one is less than 7. Yes.
Okay.
But you may find other patient being transfused even with a HB of 10, which that blood could have been used by a dial case.
Yeah, especially the patients who are on chemotherapy,
Yes.
who will honestly need this blood.
Yes.
There is no alternative. They have to get this.
They have to get blood. Another thing that I think should be important to put into place is when somebody is coming for blood transfusion, let them make a prior visit to the institution. They are given a donation note, and then they go to where they are donating the blood, such that when now that patient is going to be admitted, we already have the blood with us.
Okay.
It will reduce the stay of the hospital, of the patient in the hospital.
Sure.
And this way, it will even reduce the infection that which can be acquired in the hospital.
When we are coming to donate for blood,
Yes.
let me give you an example. My patient is blood group B.
Yes.
Am I supposed to look for people who are also blood group B, or what are your recommendations?
Ideally, if you are B positive, you should get blood from B positive. But these donors of yours, they can be any other blood group.
Thank you.
Because at the moment, you don't know even who your donors are, which blood group they belong to. So what we do, we write them a note. They go to the blood donation sites where they donate blood. But for us who are going to remain with the patient, we know your patient is blood group B, so we will go and request for B positive. But your donors who could have donated could have been any other blood group. Yes.
Do you think there is something that the government can do to enhance the blood donation and the blood availability?
Yes, I think the government, one thing that it should do, it is to address the understaffing. Because at times I even sympathize with the people I find at the blood donation site, because they are few in numbers. So at times when those donors come in big numbers, they even have to ask for help from other hospitals so that they can be able to bleed the donors, especially when they are going for a campaign in the institutions, because they are not as many to do that work. Again, I also believe that if the government was providing the reagent on time, once the blood is donated, let it be screened immediately, because once the blood is donated, it has a lifespan. And actually the lifespan of blood is 35 days. So if it was donated today and then screening is done 1 week after, it will have reduced the turnaround time of it to be transfused to the patient. So what the government can do is ensure that these reagents are provided right on time, and the screening is done immediately. In that, we can now be able to have the flow, a quick flow of the blood.
And as well, it is going to reduce the anxiety of both the patient and the relatives. Because you don't tell me that I can donate blood today, and then this blood is not available. It's a whole week gone, and the blood is still not available. How do you even convince
Actually,
people?
that is the challenge that you are facing at the moment. But I'm grateful to the government because it is coming in and it is now buying the reagent. But that is what you are experiencing like about 2 weeks or 3 weeks ago, because there was no reagent for screening of this blood. But now I hear that the reagent have come, and we believe that no blood is going to expire in the blood bank.
Do you have a blood drive that is coming in?
Actually, blood drives are every other day. You can pop in our blood transfusion center, but also us as in the hospitals, there is a way we can organize our blood drives to the patients for the benefit of our patient, for the people who are going to visit, the visitors who are going to come and see the patients, and for the surrounding community. Like last year in our institution, we organized a blood drive, which was very good, and we were able to capture the relatives who were visiting the patient, and even the staffs of our hospital were able to give back to the community.
Oh, that's so nice. That's so nice. So I'm just curious.
Yes.
How do you turn a one-time donor into a lifelong donor?
Every time that person comes to donate blood, we give them health talk. and tell them the importance of blood donation, that the more you donate blood, the more is produced. So these people are motivated, and there's no greater love than feeling that your blood is running in someone's vein. So the donation part of it is a self-satisfying. But we maintain them through the health talks, and we also follow them up to know how they have been progressing. So many things that we need to sensitize our healthcare workers about the blood. There is a lot that we can discuss about blood.
Okay.
Yes.
Sure. I think we are going to give you another platform some other day.
I will be available.
Some other day.
Trust me, I
We
will
are very
come.
grateful.
Yes.
Thank you so much.
Thank you so much, Pauline. I really appreciate it when we talk about blood, because to me, blood is everything.
And to my viewers, we have come to the end of our episode today, and I want to thank you so much for the support that you're giving us. Continue subscribing, like, share. Until next time, see you then.